Hello, everybody, and welcome to this Monday evening special edition of Facebook Live with the On-Air Advocate, where we look to provide education, support, and empowerment for all of those with different abilities, mental and medical illnesses, and their caregivers. My name is Tammy Flynn, and I'm the host and producer of the On-Air Advocate, and I'm absolutely so thankful that you guys have joined us tonight. And as we wrap up this 2-week-long focus on holistic and natural medicines and supports, I could have thought of no better way than to have Mr. Dayne Sullivan here all the way from Arizona, right? Originally from Georgia, right? Did I have that right?
That's right. That's right.
All right.
Yes.
He is a naturopathic medical student as well as a researcher. He is the co-chair of an integrative medicine collaboration of advocacy and community that builds awareness, as well as a homeopathic enthusiast. So I know you'll do a better job of describing all those things than I just did. So I want to welcome you.
I'm glad to be here. Excited.
I'm excited as well. So I know when we had our discussion, there is just, I thought like in the first 20 minutes, my head was just like wheeling, thinking about all the people I know and the buzzwords that are out there. Like how many times in a given day do I hear the word holistic, it's natural, and these different supports and what actually works, what doesn't, what's safe. And then I talk to you and I'm like, there's a whole school for this. People become doctors. And so you really broke it down so well for me that I was like, you got to be on the On-Air Advocate and share this with everyone else. So, to kind of start out, what is naturopathic medicine?
So naturopathic medicine is something that's actually been around quite a long time. It's been around for almost 100 years here in America. And naturopathic medicine, in short terms, is the best of ancient natural medicine practices that's also combined with conventional modern medical practices. And so I always say that naturopathic medicine is the best of both worlds, whereas we take what we've learned over the several thousands of years as far as Chinese medicine and what a lot of people in America would call Eastern medicine. Mm-hmm. And we couple that with allopathic and conventional medicine, which is usually thought of as like surgery and drugs. And so I feel like we've probably got the most well-rounded form of medicine in existence right now.
Okay. Now, I know we had spoke a little bit about the difference between like being licensed and unlicensed states and what that's all about. And I know that's part of kind of that coalition that we were talking about, that advocacy and, that community that you're a part of. What does that mean? What is the difference between me coming to you as a naturopathic licensed doctor versus the person down the street that practices out of their other office that does health and wellness?
Okay. So there's a big misnomer about naturopathic medicine, and I think we talked about it before. So naturopathic medicine is currently licensed in 22 states in the U.S., and that's constantly growing. There's 3 states this year that are really pushing for licensure, with New York being one of them, which is a big, big deal. So the difference is if somebody says they're a naturopathic physician, that means that they have attended an accredited 4-year naturopathic medical program, just like the one that I'm in. And they are in a licensed state. They're board certified legally as a primary care physician, but they are also certified as a natural expert in natural medicine. Versus where if somebody says they practice health and wellness, that could mean 100 different things. It could mean that they took some classes at a community college and they have a certificate in wellness or nutrition, or it means they could have gone to a number of online schools and gotten some certificate or some degree, but they're not a licensed physician whereas an NMD or an ND, a doctorate of naturopathic medicine, means that we hold the same rights as a family care physician as an MD or DO does.
Okay. And like you said, so you can write prescriptions for people that same way.
Yeah. So, for instance, and each state has a little bit different scope of practice. Arizona is currently the biggest scope of practice, but we can do everything from we can write a prescription, we can perform minor surgery, but then at the same time, we can do physical adjustments like a chiropractor would. We can prescribe herbal medicines like an herbalist would, and we can also perform acupuncture as an acupuncturist would. So we hold all of the rights that an MD does, but we also hold the rights that most chiropractors do and that acupuncturists do.
And so through your program, how long is the program in Arizona that you are currently in? Is that a 4-year program?
It's a 4-year program. And so it's actually, we actually have a bigger curriculum stuffed into 4 years than your average MD school will, because we still take all of the classes an MD does. We take anatomy and physiology, biochemistry, microbiology, pharmacology, pathology, histology, all of those things the first 2 years. But then on top of that, starting second year, we also stack on acupuncture classes, homeopathy classes, physical adjustment classes, nutrition classes. So it's still a 4-year program, but I've actually talked to a couple of alumni that have their MD and their ND. So
Okay.
they're a conventional doc and a naturopathic physician. And the 2 or 3 people that I've talked to have actually said that the naturopathic program is tougher, not because it's superior or inferior. It's just because we've got everything that an MD school has, plus we pack more into it.
Okay, so there are currently, if I heard that right, there are 22 states that are actually licensed.
Yes.
So if you are going to see
Yes.
someone, in those states, and where can people find that information so that they know if they're going to somebody that they are licensed and that their state is even licensed? I mean, where would you find that kind of information?
So the best place to go is naturopathic.org. It's just the word naturopathic.org. And that's the actual site of the American Association of Naturopathic Physicians. And by going there, if you go to the top of the screen, it'll say find an ND. And if you click on that link, it actually has a list of all of the states that are currently licensed. And it has a way to find by zip code where each of the licensed physicians are.
Okay. And for states that aren't licensed, I guess, how do you make that? I mean, how do you make that decision? I mean, I even know in my area, I'm in Wisconsin, and I could count the dozens of people within my network in and outside of my network that sell vitamins in their, in their little stores that they're in at their health and wellness centers. Yep. There's somebody that's at the fitness place that does this outside health and nutrition and consultations. And then there's naturalists, like we have where I live in my area. There's like some of those specialty like naturalist stores, where they have kind of the things outside of like a conventional GNC. So how do you know that you're going to someone, if it's not a licensed state, that really truly has done the work?
So I always ask whether I'm networking, or even when I was a patient before I came to school, is I would look up and see where they went to school. First of all, because I believe there's 6 now. There's another one that's in the works of opening in Maryland, I believe, but there's a handful of accredited naturopathic medical schools. There's several in the United States, and I know there's at least 2 in Canada. And what you can do is you can ask, have you been to an accredited naturopathic medical school? And if they have, then that means they have actually gone through a naturopathic medical curriculum versus just, if somebody says, oh, well, I've gotten, I have a naturopathic education. There's a lot of different websites and schools out there that will give you a degree or certificate in natural medicine. But that doesn't necessarily mean anything, because the question is, are you licensed? And so if someone holds a license in naturopathic medicine, then that actually means they've gone to school, they've gotten a doctorate degree, they've gone through clinical training, and they've also passed a regulated board exam, and they've earned the right to that licensure. And all of this is, if you get a provider off of naturopathic.org, all of their providers have already gone to school and they've been licensed. So by going to that website that whoever you're going to is legitimate. The other thing that you can do is you can check out and see, there's a number of different naturopathic associations. I know there's one for endocrinology, one for pediatrics, for moms that may be looking to see, if there's a naturopath that actually not specializes, but focuses in pediatric medicine.
Okay.
There's a number of naturopathic associations. All of those can also be found online at naturopathic.org. And so I just, like with anything else, if you were going to go get your haircut, you would want to know, hey, is this just somebody that picked up a pair of scissors and trying it out? Or has actually been to school for this? And so I always say the best thing to do is to check credentials and check and see, have you been to accredited school and do you hold a license?
Okay. So I'm understanding this right. So if you have gone to a school though, but you're not in a licensed state, you can still hold the license, but the state isn't licensed, or no? If you're in a state, like in the state of Wisconsin, if someone went to school for it, they might graduate, they might have a licensure through the school, just our state isn't licensed to practice that way.
So let me give you an example. I'm going to graduate from the school in Arizona. And so I'll sit for my board exam in the state of Arizona. Now, if I wanted to go back to Georgia, what I would do, and what most naturopathic physicians do when they're going to an unlicensed state, is they'll park their licensure in a licensed state. So I would get my Arizona licensure, and then I would go to Georgia, and I'm still a licensed naturopathic physician, but I can't practice clinical medicine in an unlicensed state. Just as if any other MD, if an MD or DO was licensed in Arizona, they couldn't go to Nevada and write a prescription. So what that means is, an unlicensed state, they can't order labs or do a physical exam or write prescriptions. But for most of the states that are unlicensed, and it depends from state to state, but most of the states that are licensed, we're still able to practice things that aren't regulated as clinical medicine. So a lot of naturopathic doctors that are in unlicensed states, they're not going to be able to write you a prescription, but they are going to be able to do things like recommend homeopathy or recommend nutritional changes. Or what a lot of them do is they work in conjunction with an MD. So, if you have an MD that supports naturopathic medicine or supports holistic medicine, a lot of times the ND will team up with them. And so even though they can't order your labs or write a prescription, because they do have the training and education, they are able to make suggestions and recommendations under the care of a conventional medical doctor that is licensed in that state.
Okay. And what you just said, so is there a difference between like holistic medicine and naturopathic medicine? Or is that all the same word? Because there's a lot of words.
Yeah, and that's the thing. And especially, it's natural health, a big buzzword in America now. And I think, so holistic medicine definitely includes naturopathic medicine. And they are kind of one and the same. Naturopathic medicine is a form of clinical medicine. Whereas holistic medicine may include a variety of things. And so I feel like the word holistic is almost thrown around to mean something besides conventional medicine. Whereas naturopathic medicine is specifically a certain number of modalities. So a naturopathic physician is someone that's going to utilize pharmacology, acupuncture, botanical medicine, homeopathy, nutrition, physical medicine, to actually hone in on their treatment plans. Does that make sense?
Yes. That does.
Okay.
And I know that when we spoke, we talked a lot about too, that there are some things that are in that holistic and natural world that sometimes people think because they're holistic and they're natural, that they're safe. They feel this security that's really a false security, as to that you can have as much of something, or you can't have too much, or it's going to be better for me. And I know we even talked about that, like shopping for vitamins and going to stores and treatments that way. Can you kind of speak to that, about those cautions and that safety? Because I do think that it makes us feel like we're in some safe zone, but I mean, from our discussion, I think there's some things to caution on.
Absolutely. So if I remember right, one of the things we were talking about is there's a lot, one of the most common questions I get is people say, well, why should I go see a naturopathic physician? Because they may recommend an herb, or they may recommend a vitamin or a nutrient, and I can just go to the vitamin store or CVS or Walmart to get that. And the reason that I am quick to say is medicine is medicine. You know, a drug is a drug. Everything from narcotics to alcohol to caffeine, if it alters your physiology, it is a drug. In the US, we've decided if it's a prescription, well, we have to watch out for side effects, and it could be potentially dangerous.
Mm-hmm.
But if it's not a prescription, if it's over the counter or it's a natural substance, then it's safe. And I don't need consult on it. And so I think just because, and it's not people's fault, it's just the way the regulation is. But a lot of people think, oh, well, I can get this on my own without a prescription. So it may help, but it can't harm me. And that's very far from the truth. I don't want to scare people away from using it, but
it's that false security that people feel.
I always tell people, right. I remember Dr. Oz years ago on his show, somebody said, well, yeah, but that's natural. And he said, yeah, but cyanide's also natural.
Right.
And it's very true, because so many times, people will think, oh, well, hey, I'm going to go get this herb because I've heard that it helps with the urinary system, and I get chronic UTI, so I'll just take a bunch of it every day. And that can be potentially dangerous, just as any drug or supplement can, if you're not doing it under the care of somebody that's actually studied it and spends day to day working with it.
Right. I know we were talking about one thing, because there is like some different herbs and whatnot that if you're already on blood thinners or have thin blood, you spoke to that a little bit when we chatted as well.
Yeah, I mean, that's a great example. And obviously I'm not a licensed physician, so I can't give anything that can be taken as medical advice. But one of the big examples that we're talked about in school is, if you're on blood thinners, and there's certain herbs, there's many herbs that have a hypotensive effect. And so hypotensive effect or blood thinning effect. And so if you're already on blood pressure altering medication or blood thinning medication, and you take those herbs, at a potent dose, or even certain vitamins at a high dose, that can alter the mechanism of that medication. And so, too much of a good thing is a bad thing. And I think you hit right on the head of the false security of, well, I'm good at this because it's natural. The reason you should go see a naturopathic physician is not only have they studied it, but because we also receive training in pathology and pharmacology at the same level an MD does, we're able to actually speak to that nutrient-drug interaction.
Right. Now, do you find, I know we were kind of talking about some myths that people think, when it comes to, when it comes to naturopathic medicine and all of that. Can you speak to any of that, things that you hear very commonly?
Yeah.
Aside from obviously this false security, because obviously we all have the false security that if it's natural, it's good for our skin, it's good for our hair, it's good for us to ingest. Yep. That's just the way our society is, because I think we hear those buzzwords all the time.
Yeah. One of the things I hear a lot is, well, it doesn't work, or how do we know it works? And what a lot of people don't realize is there is research being provided at an alarming rate that actually backs up the modalities that we use every day. Probably the biggest one is botanicals. But as far as herbs go, if you pull up PubMed or you pull up Google Scholar and you search ginkgo or ginger, there's literally hundreds upon hundreds of articles that are coming out where we're performing clinical trials using different supplements, different vitamins, different herbs and botanicals. The other one that's big upcoming, that's easy to find, that people are wondering, well, is there anything to back this up, is acupuncture. There's immense amounts of research coming out now supporting acupuncture in clinical trials, in clinical models and case studies. And so to me, one of the biggest things I hear is, well, how do we know this works or it doesn't work or there's nothing to back it up? And literally, if you pull up Google and you pull up a research database, that's a myth that's quickly dismissed.
Right. Now, can you speak to, in this whole natural and holistic week that we've been having, we did have an acupuncturist on. And so in your training and your teaching that you're learning in this 4-year degree, what are some of the benefits that you have found with acupuncture? Or that you've learned about it, or is there just millions of things it's good for?
Well, it's good for, so here's a great myth, to going back to what you were saying before. One of the great myths is, well, acupuncture is only good for a couple things. Like one of the big things it's good for is chronic pain, which is true, or, well, it's good for headaches, which is also true. But there's a ton of stuff that acupuncture is good for and well indicated for. One of the biggest things right now is during cold and flu season. Acupuncture is great for a lot of acute conditions. Now, one thing I always caution people with is, if you're going through or think you could be going through, a medical emergency, one thing that our professor speaks to is, acupuncture is not going to treat a heart attack. If you think you're going through a medical emergency, that's not the time for holistic medicine. But as far as chronic illness goes and some acute illness, acupuncture is incredibly, incredibly good for. Before, I had a really nasty H. pylori infection, and I went to go see acupuncture, and it did amazing results. Within a matter of days, I saw a big, big improvement. And the reason I feel like I can speak to stuff like this is I came from Georgia, which is the land of two different types of people. 99% of the population is, if you say naturopathic medicine, they either don't know what it is or they think that it's witchcraft. And so I got to see firsthand, hey, I think this is the type of medicine I want to go into. I was headed into neurosurgery and took a completely 90-degree turn into naturopathic medicine, and got a chance to experience the modalities firsthand myself to see, wow, this stuff really is efficacious, and this is something, that's worth spending time and money on.
Right, right. It's so interesting to integrate all of that, all of that together. And do you find that because of that, is that why you kind of made that turn from like more of that neuro doctor track?
Yeah, well, yeah, real quickly. So when I was in undergrad, a friend of a friend got me in touch, and I connected with somebody that was pretty high up in the research department at a level 1 trauma center in Georgia that worked with Mercer University's medical school. I ended up being an undergrad associate for the neurosurgical team. And during that, neurosurgery is super cool. I was a huge, kind of fan of Ben Carson as a surgeon growing up. I knew that's what I wanted to do. I was trying to get an MD, PhD at either Duke or St. George and get a neurosurgery residency. And then during that research, I saw how miserable their lifestyle was. And the two things that made me reconsider was, one, their lifestyle was, we get to the hospital at 5 a.m. and we run ourselves ragged until 10 o'clock at night, and then we do it again every day. Mm-hmm. And the other thing that kind of turned me away from it was, if a patient lives through the surgery, then that's a win. Now, they may leave scarred, they may leave with deficits, neurological or otherwise, and they may or may not have any good quality of life in the future, but they survived the surgery, so we count it as a win. And that's nothing against the surgeons. That's just the nature of that form of medicine. And to me, it was really discouraging, because I thought, I don't want to spend 20 hours in an OR, and as long as the patient makes it out alive, well, then we consider it a success.
Right.
I was battling a illness at the time and got the chance to start experimenting with naturopathic medicine through a holistic functional practitioner in Georgia. And after being on chemo for about 6 years, I finally actually started getting better using the naturopathic approach. And so that made me think, hey, these guys do more than just collect money and say, well, we hope it works. And they produce great results. And so the more I started looking around, the more that I knew this is kind of what I wanted to do, because it was really aligned more with what I want to be as a physician.
That is awesome. And it takes it to that next level, it integrates it so much more into that patient care for the longer duration, of time, not just seeing them through the surgery and then it's done. It's that holistic health
Exactly.
that, carries on for a lifetime. So if there would be any great tips that you would want to kind of leave our listeners, I guess, with, or the people watching this, do you have any 5 favorite things or 4 especially we're in this cold and flu season? Is there anything you really love?
Yeah.
I know that I know Cynthia, the pharmacist.
Yeah.
Yeah, and she's awesome.
Fan.
She has her funny things that she loves, but her honey and her neti pot and just some of those natural elements, but also some things that she feels are just kind of myths that are created that don't always work, extremely, extremely well. Do you have any favorite things that you're always what, you need some zinc when you don't feel good, or anything that you feel is kind of one of those safe things that you love?
Well, I can't actually provide anything like that. Unfortunately, I'm
Right.
not licensed, and so that's one of the things
Right.
that I can't give any type of medical advice. But I can give 4 or 5 things that I've learned from experience and that I've
Okay.
seen people go through. So I can tell you that the first thing is go to the doctor before you get sick. Probably 90% of the stuff that we battle as Americans is preventable. The 2 of the top 3 killers in America, heart disease and cancer, can largely be prevented. Maybe not every case, but a large majority of them can. And so many times, I'm super busy. I get it. Before medical school, I was a restaurant manager. But I also know from experience and from watching other people that it's so worth it to go to the doctor and start working on getting yourself healthy and staying healthy than it is to go after everything's kind of tumbled down. The other thing I can tell you is people are real quick to want to get healthy, and then they look at the cost. Naturopathic doctors are humans, and as physicians and medical students, we understand that people have a budget. But we also understand that it's a heck of a lot cheaper to stay healthy than it is to get sick. I hear people all the time, well, I want to eat organic, but that's more expensive. And my answer to that is, yeah, but a year's worth of organic groceries is still a lot cheaper than a year's worth of chemotherapy.
Right.
The other thing I would do is I would tell people, like I do outside of medicine, is, don't listen to the media and the hype, but actually research and check out things for yourself. Before I came out here, I knew I wanted to practice every form of naturopathic medicine except homeopathy, and it was because it was a pile of trash that didn't make sense. Now that's my favorite modality, and it's, as a physician, something that I will want to focus on for the majority of my patients will be homeopathy. And if you go on Twitter or you go on Google, you'll get all this naysayers that it doesn't work or it doesn't make sense. But I've shadowed someone that specializes in homeopathy, one of the best in the country. And week after week after week, we had cases come in that nobody else could solve and hadn't gotten better in 10 years. And we used homeopathy and got amazing results. So I would say,
what is that?
more
If
than anything,
we pause for 1 second,
yeah,
what
sure.
does that actually mean? Because I was going to ask you too, the botanicals, what I'm saying is one of your modalities.
Okay.
What are the botanicals? What is the actual homeopathy itself?
Okay.
So someone just practicing that.
Okay. So are you asking what it means to practice it, or what actually is the medicine?
Well, what's the homeopathy? Like when you're saying that you followed somebody
Okay.
who does homeopathy, does that. What
Okay.
is
Okay. So homeopathy is one of the modalities that we use as naturopathic physicians. Homeopathy was brought about in the 1800s. It was, I guess, founded by Dr. Samuel Hahnemann. And so homeopathy, which to unpack this, we'd probably need a whole nother episode. But homeopathy is you have a substance, and whatever symptoms a large amount of that substance would cause is what it will cure. So the best example to a newcomer of homeopathy would be coffee cruda. And so coffee cruda, if you think about it, if you drink coffee, you get excited. Sometimes you get really hyperactive. Your mind races, and you're really jittery. And so a homeopathic dose of coffee is usually used for people that can't calm down at the end of the day and they have trouble sleeping. Because a large dose of coffee would keep you awake at night, which means a homeopathic dose of coffee will help calm you down so that you're able to wind down and go to sleep. And so there's a whole slew of debate about homeopathy, but there's literally thousands of homeopathic remedies. And there's case studies dating back all the way into the 1800s of homeopathy being very successful. And outside of America, it's still very successful. I just read a couple months ago, in India, it's one of the most widely used forms of medicine still
really?
Today in 2018.
Really? And then what is the botanic? You were talking about the botanicals. What is that?
So botanical medicine is the use of herbs. Botanical medicine is the word we use for it in naturopathic medicine, but it's the use of herbs. Usually it's plant medicine using different constituents and phytochemicals. And so it's usually given and prescribed in tinctures or teas. Once in a while, if it's a skin condition, a salve will be suggested. But so for instance, if you see the little bottles of tinctures of like ginkgo or passion flower or kava kava at the health store, that's an example of botanicals.
Okay. And would you say in the US we practice the most amount of, I wouldn't think so, like the naturopathic medicine, or are there other countries, like who's the top in that? Who practices that the most? Do you know?
As far as naturopathic medicine, it would be the U.S. So naturopathic physicians are only licensed in a few places. Right now, I think the U.S. and Canada and parts of Australia. As far as naturopathic medicine, probably Canada and the U.S. are the top ones. As far as practicing like holistic and alternative medicine, absolutely not. If you took something like homeopathy, India by far outdoes us. If you did botanical medicine, South America completely does more than we do.
Okay. So all over it's a little bit different, but we definitely have a lot going on here. And so the organization that I kind of slammed what all the letters in the name were that you're a part of.
Yeah. N.A.C.T.
Yeah. So you are part of an initiative and a program to try to get all of our states licensed. So how is that process going? Yes. And what is the name of that again? That is the Naturopathic Advocacy, Naturopathic Medicine Advocacy Community Awareness, right? There's a big word.
Yeah, you're right. Yeah, Naturopathic Advocacy and Community Awareness Team. And so the thing that we're doing as an organization, I'm one of the co-chairs of the chapter at my school. And so InAct is trying to bring advocacy and awareness to the licensure of naturopathic medicine, because there's a lot of people, like you said, everybody probably knows 5 or 10 people that would like to see a naturopathic physician. And especially there's a lot of people in unlicensed states that they would rather have a naturopathic physician as their primary care provider. But unfortunately, without it being licensed, naturopaths don't hold that right. And so our goal as an organization is to bring awareness and advocacy to that so that eventually we can have all 50 states licensed. As far as how's that going, there's been a number of states licensed in the last couple of years. I know that North Carolina is making a big push for it this year. New York is making a push for it. I think Oklahoma is making a push for it. And so every year there's at least 1 or 2 states licensed. It's just a matter of time, I think, until they're all licensed.
Okay. And I know that when we chatted, you had said there's a little bit of pushback on that because in some states that have been practicing unlicensed for so long, you have a lot of people practicing holistic type medicine or holistic clinics and vitamins, those kinds of things that that would make them have to redo schooling, right? Of some kind or certifications.
That's the thought. Yeah. Is so if you are in what is now an unlicensed state, so let's take Alabama, for example. Alabama is unlicensed, and there's some naturopathic physicians there that, are practicing with a license in other states. And there's a ton of other people, that are health coaches or they're naturopaths because they got some certificate online. And when a state becomes licensed, that gives the naturopathic physicians the right to practice as primary care physicians. If that's what the state decides, then once we're licensed, we can practice as physicians. Whereas somebody that hasn't been to an accredited naturopathic medical school and passed the board exam doesn't hold that right. And so there's a couple states, Florida is one of them, where you have a lot of people. Natural health is huge in Florida. And I think one of the reasons that some of those states haven't been licensed is because the only people who would hold the right to practice naturopathic medicine would be the naturopathic physicians.
Right. Which then obviously would cause a lot of stir up in whatever state you're in for that amount of time.
Like I said, just for the record, I don't have a problem. It's not, I don't think we're better. It's not we're a physician and you're not.
But it's making everything safe. And I mean, because, know, there is no, there might be one person that's been going to hundreds of classes and been practicing for 20 years. And the next person goes for, a 1-week certification online, and they're calling themselves the same thing, which leads people into a unsafe, that feeling of security it's really not secure. So
exactly, because that's what you don't know. You don't know. You may have somebody that's incredible and they deserve the right to practice, and it would be a huge loss. But at the same time, you may have a kid that graduated high school and then took a couple classes because they think, hey, I think it'd be cool to be a doctor and help people, but I don't really want to go to medical school. And they have a piece of paper hanging on your wall, and you know the difference.
Right. So the bottom line is that we need to research, right? We need to research the people that we see. We need to pay attention. We need to, listen and always investigate for yourself. So really back to that advocating for yourself at all times.
Yeah. That's one of the things, I don't know if I mentioned it before, but one of the differences I've seen with naturopathic physicians that I've been around versus conventional medicine is we're a big believer as naturopathic physicians that it's literally a relationship between the patient and the physician. The old school way of looking at medicine in America was, I get sick, I go to the doctor, I tell him my symptoms, and he tells me what to take to get better. And we figured out, so many of us on personal experience, that's not a great way to go.
Right. Because that doesn't always give, the full answer and the full scope. So, and I think that is why there are so many people that seek out more naturalist or homeopathic medicine, is because they've tried the conventional stuff and it doesn't work. And so what I think you're doing is phenomenal, because it really bridges the two together. And until I spoke with you, I never knew that, through the licensure, that you were learning the same things and going through those courses just like an MD, as well as learning all those other modalities. So I think that's fabulous. And I think that Wisconsin should become licensed.
That would be great. The best way I can say it is a famous naturopathic physician, Dr. John Bastyr. They asked him, how do you pick which modality? And he said, I use what works. And so many times, you'll get people that the reason I love naturopathic medicine, and like you said, it really bridges the gap, is so many people think, well, it's either conventional medicine and it's drugs and surgery, or it's natural medicine and there's no in between.
Mm-hmm.
And we're completely flipping the tables on that paradigm, because as a naturopathic physician, you use what works. And sometimes the best indicated thing is a pharmaceutical drug. But then other times it's like, that can be a last resort, but we should really address diet. We should really address your physical structure. We should really address it with herbs and homeopathy first, because those are a lot less invasive. And then we leave drugs for last. And so many times we get great results before we ever reach that point.
Right. Well, I think that is fabulous that you are merging all of this together. I wanted to make sure that website that you were talking about for people to go on and to investigate and to make sure, what's kind of going on in their state, or doctors and what they've done. Are you going to be able to drop that link below for us after we're done with this segment? I think that will be great, so that people have that access. For that, I want to make sure that I got through all of my questions, because I had a whole list of them for you. Sure. I think that I did. And now, when do you graduate? How much longer do you have?
A long time, it feels like. So I'm on track to graduate in 2020. So I'll graduate in June of 2020, and then later that year I take my first board exam this summer, and then 2 years of clinic, and then graduate and take a second board exam to be a licensed physician.
That's awesome. Well, you know what? You're going to blink your eyes and it's going to be over. Really, it is.
Well, we always say, Dr. Guillermo Ruiz, somebody that graduated this past year, he always said the best way to describe medical school is really long days and very short years. And I absolutely agree. The days sometimes seem like they're never going to end. And you look back and go, oh my gosh, it's already been another term. Like, we already finished finals week again.
Right. Well, yeah, you'll be done. You'll be done before you know it. And I thank you for breaking that down. I know we talked about when we get back onto some other modalities and subjects, we definitely want to have you back on again to give some better explanation. I know anybody who listened to this today, if you have any questions or you need more of the better definition for each of those modalities or anything, I know that Dayne will be checking the feed on this Facebook Live. And so I thank you so much for taking time. I know it's like, what time is it there? It's almost 10 here, so it's almost 9 by you, right?
Yeah, it's about 8:45.
And it's probably warmer than it is here too, I'm thinking.
Yeah, there's tons of people with jackets on today because it dropped down into the 60s.
Oh, well, and actually it warmed up a little here to like 40 and foggy and rainy, but I'm still jealous. We need that vitamin D. We need some sun here in Wisconsin. Yes. So thank you so much for taking the time out tonight. Again, if you do have any questions, make sure that you drop them below so that he can answer them for you. But I thank you guys all for tuning in tonight and learning a little bit more about this naturopathic medicine. Anything else to leave us with that you want everyone to know? Anything? If not, you filled us in a lot, so it's okay.
Yeah, I think the biggest thing that I can leave you with is something you mentioned a few minutes ago, that at the end of the day, whether you see a naturopathic physician or you see an MD or a chiropractor or acupuncturist, whoever, that health is a personal responsibility. And I think honestly, if I could get anybody to do anything, it would be, the one thing that is in our control is health. You can always get more money. You can always move to a different location, but the one thing that you start out well with and you should hang on to more than anything is health. So if I could ask people to do anything that are seeing this, is please, please, please take responsibility for your health before you do anything else. Before you trust somebody else, make sure that you're doing your due diligence.
Right. Amen. Amen to that. And making sure that you're always advocating for yourself, because nobody's going to do it for you. So you need to ask the questions. So on that
Yes.
note, you have a fabulous evening. Thank you everybody for joining us on the On Air Advocate. You will be able to find this in the podcast format as well as on YouTube after this broadcast at www.onairadvocate.com. Thank you so much again, Dayne. We really appreciate you being on, and we will talk again soon. Have a good night.
Thank you. Have a great night.
All right.
Bye-bye.
God bless. Bye-bye.